Doctor, I would like to review some of the medical words you used on your direct examination. All right. Tell us about the osseous tissue. Well, the osseous tissue, or bone, is the hardest type of connective tissue which provides a supporting framework for the body. Doctor, the bone marrow or medulla is what? That is a soft central part of bone. Is there red marrow and yellow marrow? Yes, there are. One fills cancellous bone and manufactures red blood cells and hemoglobin. The other fills the medullary cavity and contains fat cells. You mentioned cancellous bone, doctor? Yes, a spongy bone composed of a loose latticework of bony trabeculae and bone marrow within the interspace. Doctor, is that different from compact bone? It is. What is compact bone? Compact bone is cortex of bone, that is, solid bone rich in calcium. Doctor, what is the diaphysis? The diaphysis is the shaft of the long bone, the spongy bone between the two tables of the skull. And what is endosteum? Endosteum is the membrane lining the walls of the medullary cavity. The epiphysis, plural epiphyses, is what? It is an extremity of long bones and the center of ossification or for growing bone. Is that a matrix of bone? Sometimes called a collagenous fiber and a ground substance in which calcium is deposited. That is a matrix of bone. And medullary cavity you mentioned, doctor? Yes. Is what? It is a marrow-filled cavity within the shaft of long bone. Doctor, you mentioned the term ossification. Yes, ossification, or bone formation. And osteoblasts. Osteoblasts are bone-forming cells. What about osteoclasts? Osteoclasts are bone-absorbing cells. And osteocytes. Osteocytes are bone cells lying in lacunae within intercellular substances. Are they osteoids? No. Osteoids are calcifiable osseous tissue, yet uncalcified. What is periosteum, doctor? Periosteum is the outer covering of bone. And trabeculae? Trabeculae are slender spicules or anastomosing bars of spongy bone. What is the trochanter, doctor? The trochanter is the bony prominence of the upper extremity of the femur below the femoral neck. And is it major? It is major or greater. Is it called the greater trochanter? Yes, the greater trochanter, that is correct. It is large bony projection located externally and laterally between femoral neck and shaft. Doctor, what is the minor or lesser trochanter? The minor trochanter is the conical bony prominence located medially and laterally at the junction of the femoral neck and shaft. Doctor, let me put you through a few more terms. That is quite all right. Diagnostic terms. Yes. What is avascular necrosis of the bone? Avascular necrosis of the bone is the death of bone resulting from deprivation of blood supply due to fracture, extensive removal of the periosteum in surgery, and exposure to radioactive substances and other causes. Doctor, the cervical rib is supernumerary, is it? Yes, the cervical rib is a supernumerary rib attached to a cervical vertebra. Doctor, did I mention the fracture that this patient had of the humerus? Yes, the patient had an arm fracture. And was it transverse? Yes, it was a transverse diaphyseal fracture. Let me ask you about the replantation of an extremity, doctor. Well, that would be a restorative surgery of an accidentally amputated limb to its functional capacity. And what does it include? It includes the restoration of circulation by anastomoses of the blood vessels. Is it internal? It may be an internal fixation, yes, of diaphyseal fractures of the bone by intramedullary nails. And can there be a repair of the nerves and tendons in that fashion? Yes, there can. What about debridement of devitalized tissue, otherwise called debridement? Well, debridement is not really the closure by suturing undamaged soft tissue of dismembered limb to stump. Doctor, there was a split thickness graft here? Yes, split thickness grafts for denuded skin areas. And was there a sequestrectomy? Yes, the sequestrectomy, which is a fancy term for the surgical removal of a piece of dead bone. And the surgical correction of a fracture, doctor? Well, this may be achieved by several methods. What are those methods? One is the closed reduction or manipulation and application of the cast, or application of a splint or traction apparatus in selected cases when the fractured ends are not in alignment. Doctor, what about an open reduction and internal fixation? Yes, that would be the manipulation and insertion of plate and screws.